By the Active Girls Healthy Women Initiative. My name is Hannah Hoke, and I'm an executive board member of the initiative, and I serve on the research subcommittee. This Coffee Talk series is a part of the Active Girls Healthy Women Initiative. Our vision is to empower girls and women to lead healthy lifestyles. We aim to achieve this vision through our mission to advance girls and women's physical activity and health through research and outreach programming. In an effort to engage our community partners, strengthen our outreach programming, and enhance research efforts and collaborations, we have developed this series, which we call the Coffee Talk. The primary goal for our Coffee Talks are to disseminate evidence-based strategies and/or information to advance girls' and women's physical activity and health. We will hear from an expert in an area that is relevant to our mission, vision, research, programming, or community partners. After their presentation, we'll engage in question and answer session and/or discussion. We'll ask you to unmute and ask questions, or if you would choose, you can put your questions in the chat and I can read those for you. So at this time, I'll introduce our speaker for today, who is Dr. Tim McGuine. Tim McGuine is a certified athletic trainer and a fellow of the National Athletic Trainers Association. He's a scientist in the Division of Sports Medicine, Department of Orthopaedics at the University of Wisconsin School of Medicine and Public Health. Dr. McGuine and his team have established the Wisconsin Sport Injury Research Network, through which a team of licensed athletic trainers and coaches collect prospective research data in diverse high school and club sports settings. His research focus is to better understand the incidence, risk factors, prevention techniques, and health-related outcome for injury and other conditions that can impact the health of adolescent athletes. He serves on the Sports Medicine Advisory Committees for both the Wisconsin Interscholastic Athletic Association and the National Federation of High Schools. The title of his presentation today, as you can see, is Keeping Kids in Sports. It's a public health issue. Dr. McGuine, the Zoom room is all yours, sir.
Thank you. Thank you for having me. Thank you for joining early in the morning. It's great to be here. As I said to Hannah before you guys got on, that the last time I was in Lexington was at the International Ankle Symposium. And it was a great meeting. And I kept thinking, I got to get back to UK and do some stuff here. And I'd never been back. So virtually is okay, but in person would be so much better. Anyways, again, as Hannah mentioned, my name's Tim. I'm an athletic trainer and a sports medicine researcher here at the University of Wisconsin. So a couple of legal things here. I don't have any relevant financial relationships to be discussed. I'm going to talk about some research we've done and other research that's peer-reviewed out there. I'm going to talk about, in addition to the research, some opinions. The opinions are my own. It may or may not reflect the University of Wisconsin-Madison, the National Federation of High Schools, or the WA. So those legal things are gone. And as Hannah mentioned, my background, I was a traditional athletic trainer. I did the graduate work at the University of Wisconsin. I was a graduate assistant with the football program and wrestling, did athletics. Um, I actually did high school outreach center for a while and did a lot of physician extending. So I did physician extending, and this made me really think when you see like 500 or 600 ACLs over a decade in your clinic, and you're taking the clinic history and you're seeing what's going on, it made me think, there's how many adults I saw with pathologies in their 40s and 50s, and they say, well, I hurt my knee playing football. I hurt my knee playing basketball in high school. And now I've got this arthritic conditions, et cetera. I was very lucky late in my career, actually in my 40s, mid 40s, and I was approached to go back to get my PhD. They asked me to go back. They said they would support it, and I was very lucky. And I wanted to study a little bit of everything. I didn't want to do pure biomechanics, and I really transitioned to education and studying population health and how it's affected and what's going on. So I still work with high school athletes. I'm going to finish here and actually go to the state high school football championships, be on the sidelines for those. So I do a little bit of everything, work with college athletes, do research here in the department, et cetera. So real quick, we always talk about the benefits of sport participation, and there's benefits in short term and long term. So in short term, we know the data's out there talking about how we improve physical literacy, cardiorespiratory function, muscle fitness in these young kids. As they get to adolescence, we talk about the mental health aspects being very important to these kids that get into sports. Long term, we see this great relationship with adult health, that if we looked at who is active and healthy as adults, more than likely they had good athletic experiences as kids or as adolescents. And as I like to say, one of the most important things, adolescent sports are not just, they're not just games for kids. People talk about this. These are extras. These are things, but they're really not. They're really a way to improve public health, physical and mental public health as we age and go through our life. And while we have this brief, you know, overview, if you want to look at actual data, so here's a youth risk behavior survey 2019. Kids in high school sports, if they're involved in a community or high school team, they're more likely to have A's than D's and F's. So they're just a real simple, quick look at that. What about mental health? I'm going to talk about Claudia Reardon's a psychiatrist. I've worked with her on a number of issues here at the University of Wisconsin, and she mentioned something to me. She said, interestingly, that half of all mental health disorders begin in the mid-teens. So if you're an adult with a mental health disorder, over half of those they can attribute to something that happened to these adults when they were kids and adolescents. So it's a very informative time. And so if we have opportunities for kids to be active and in team opportunities, we see that. And there was a great review paper in 2021 talking about how the mental health of athletes, mental health of kids has really improved this way and all this. And again, this is very important now. We have so many kids on social media, and people talk about the link between social media and adverse mental health issues. And here these people are saying, these mental health experts are saying, there's this great opportunity right now in our state. And it said, and in interesting statement here, youth sports, she said, youth sports offer the most cost-effective, widely available mechanism to improve mental health. So we have something available right now that's out there. What about getting into adults? Here's just a real quick systematic review talking about 83% of studies moderate to strong relationship between sports participation and physical activity, and higher levels of physical activity are persistent. So we see that if these kids are active for at least 3 years in high school or in adolescence, we see these transitioning to adults, which are all good things. This is great. This is what we want. And I kept thinking, it'd be great to do a new study if we could study this. And I said, if I had a magic unicorn shower me with money, I would get 10,000 or 20,000 fourth and fifth graders and follow them for the next 20 years of their life and see who was into sports. And we could really lock this down and figure out what's going on and do again systematically what's going on with people and their health. One of the mechanisms we can look at athletics, though, in the United States is through the high school associations. I know the club sports are very important. They do a lot, but we do have this mechanism where high schools have this opportunity with high school athletics. And we estimate approximately 8 million kids in the United States play some sort of interscholastic sport at their school, which is over half the students. There are 51 state associations that have these, and they have these organizations reporting to the National Federation of High Schools, and they look at this and say this. Now, I know what some of you'd say, well, how do we have 51 when there's 50 states? Washington, D.C. says they're a state, so they have their own state association. We can debate whether they're or not are, but that's how we come up with 51 state associations. So we had this mechanism, et cetera, and this is going on. And I thought about this, this would be good to study this. And then this happened. So in 2020, obviously spring 2020, impact of COVID-19 came. We were shutting down sports, we're shutting down schools, we're shutting down businesses, et cetera. And it'd be interesting to see what was going on in Wisconsin. We had the situation where initially they said we're going to close school and sports for 2 weeks and start it up again. And right away, my radar went up. I'm like, wait a minute. I can't believe we're going to do this. And I talked to parents. I said their kids are going to play their spring sport. They're practicing at home. They're doing these things. They're going to get ready to play. And then 2 weeks later, they were told again, oh no, we're going to do 2 more weeks of no school, no sports. 2 more weeks. And they said, and the parents I spoke with said their kids were just in a funk. They weren't leaving their bedrooms. They were just had basically checked out. So we said, could we study that? This isn't a great way to look at the effect of sports and the ability to impact health, but what if we look at this? What if we start doing a series of samples? We couldn't look at kids and talk to kids in person, but we could do some online things. And when we did this, we said, well, let's survey 300 to 400 high school kids in the state of Wisconsin and see how they're doing. Let's measure their depression with a PHQ-9. Let's look at physical activity through the high school HSS PFABs, PEDS Quality of Life Index. We'll ask these same measures and see how they're doing. It blew up. uh, the 300-person sample became 500. I kept going back to the IRB saying, we got to change this. We got to add more people. And then people from other states heard we were doing this and said, could they have their athletes take this survey? Could their students take this survey? In Florida and Illinois and Oregon, we're saying, hey, we'd like to have our people get same access to that survey, and you could do this. And this 500-person survey became 17,000 adolescent participants in about 2.5 weeks' time in May of 2020. And one of the things we looked at, again, because we didn't have this longitudinal cohort, but we did look at as a snapshot in time. So the green lines in both and all of these uh, charts represent the expected values. So depression of the PHQ-9, we saw the girls and the boys both reporting much higher levels of depression, self-reporting levels of depression, what we would expect to see. Physical activity levels were less than a third of what we had expected based on population norms. Health-related quality of life, we should see those in the 90s usually, 88 to 92 out of 100. And obviously these were quite a bit lower. And in each case, if you look at the girls were performing worse than the boys. So there was something going on here. And that it'd be easy to say this is sports, but it isn't. I recognize this. It could be the relationship. Hey, if they were listening to the news and thought they were going to die from this disease, or they couldn't go to through, or they saw their dad and mom thrown out of work, there could be a lot of other factors affecting them other than just lack of sports. So that's a controlling influence, and we couldn't control for that in all ways. We had to recognize that a limitation, but there was obviously something here that needed further looking at. We were able to look at, however, in terms of our populations in Wisconsin. So we've been collecting for some of my studies depression data with injuries. And so we could look at samples of high school athletes in Wisconsin and how they reported their depression levels over the last decade. In different studies, we did these cross-sectional studies, cohort studies, and we could compare them now to what was going on in May. And so the yellow bars are representing our historical data, levels of depression, again, with the PHQ-9, and the levels we saw in the red bars of the May 2020 data. So in each case, we're not we're doing much worse. And as you look at that, the girls were reporting higher levels of moderate to severe depression than the boys. They were both in quite a bit more than they were historically in Wisconsin, but it was much more prevalent in the girls. So we said one of the other really disturbing things we found was this and the self-harm question. If you looked at what was happening, so again, we'd asked this question for years. Historically, we had approximately 2% of the girls in our studies in Wisconsin reporting some levels of, they've reported thoughts of being self-harm or suicide. And that's, to me, it's pretty high. Uh, but if you look at what happened in May of 2020, then it jumped up to almost 15%. That's a huge, huge, uh, incredible, I guess, really finding that really made me evaluate this. And when I took this to our psychiatrists and our people on our team, one of the first things they said, you got to rerun the numbers. That can't be. It can't be that high. That's as high as we've ever seen it. And we saw this as well. The boys, we saw the same thing. Less than 1% reported, thoughts about self-harm. Historically, that jumped at 8.5%. So if we extrapolate it out, we said in Wisconsin, that'd be 11,000 high school athletes in Wisconsin talking about self-harm in May of 2020, which is just incredible. And I go back to what Claudia Reardon said, that as adults, these people, the mental health aspects and problems with adults, they're beginning in adolescence. Well, we've been introduced a whole lot of mental health adverse effects right now in this teenage group that we don't know what's going to happen to them 20, 30, 40 years from now. What about, you know, again, we're looking at historical data, et cetera. In the fall of 2020, we were able to look at this again. Now we had a situation in Wisconsin, which were in some states. We had this opportunity where we had areas of Wisconsin were back to school playing sports. Other counties were saying, no, it's too dangerous. We're not going to let anybody in school, no sports. The athletic fields are closed. We had a situation where we have this counties next to one another. We'd have kids playing and going to school in some limited fashion, and other kids going to school but not having sports, whether it's online school or not. And we looked at these same data that in the fall sport participants versus no fall sports. The yellows are yes, these kids were able to play a fall sport. There's an anxiety measure. And we showed that no anxiety was much higher in the kids that were able to play some sort of fall sport in the fall of 2020 versus those that didn't. And we saw this huge disparity. And now we did control for, we asked them, were you in-person school? We looked at their economics in terms of their poverty levels by county and looked at that and looked at all these factors. And still, that athletes who did not return to sports in the fall were 4 times more likely to report moderate to severe anxiety, which is this. Now we had this comparison rate taking place one-on-one. One of our researchers, Drew Watson, does it's fantastic. And I got to say this right now. One of the great things at Wisconsin is we get this opportunity to pull in all these experts from kinesiology or the med school or the veterinary school or different aspects of the campus. And I like to say, when we have a meeting and sports medicine, and I sit with 8 or 10 of my colleagues, I'm the dumbest person in the room. We have tremendous experts from all over doing great things. One of the things Drew Watson looked at our data in the fall and said, can we look at some aspects because we're talking about, it's not just sports. Physical activity is very important. If we are physically active, I can go for a walk, go for a jog, hit a golf ball, do something. That's great, and we should do that. But is that better than being in sports participation? And he did a secondary analysis and said that the kids that reported, similar levels of physical activity uh, were reporting higher depression and anxiety if they didn't play a sport. So we could look at same levels of physical activity, kids with sport, kids without sport. The kids that had similar levels of physical activity but were not playing on a sports team had a greater and negative impact. Their anxiety was increased, depression, quality of life. And so Drew basically said, I think we're looking at something that physical activity is great, but it only explains a small portion of the mental health benefit, that there's something beyond that, that the sport participation does more. The team aspect, the team building that those systematic reviews talked about is that they said were present. And I know this is not something we're not going to show this video, but if you get a chance or something really good, HBO had come out in the January 2021 with an episode saying how sports were bad. Kids were playing sports and putting their communities at risk. They were being selfish. They wanted to do sports only to get scholarships. They didn't have their greater community in mind. And we kind of pushed back on that. We contacted them and said, I think there's something missing here, that you have to look at the other aspect of this. HBO reached out to me and I said, you don't need to talk to me. You need to talk to like the psychiatrists and physicians in our groups that we've worked with. And they did a great thing. If you get a chance to look at that, it's a really good, it's depressing to look at that, to see what happened. The families dealing with teenage suicide in the summer and the fall of 2020. But it isn't. I think Claudia said a great comment. COVID-19 is if we were having our whole nation's, antidepressants taken away, anti-anxiety medications. And Alex at Vanderbilt basically said it. It's like the risks of not playing sports were greater than the risks of playing in terms of disease states, et cetera, and community transmission. So that's one thing. It's not the best way. Again, if I had that magic unicorn showering me with money, I'd get 20,000 kids. We'd follow this. We'd be able to do these things. This is what we could do in 2020 with these cross-sectional studies looking at historical data. So if we move beyond that, okay, we're beyond that 3 or 4 years later, we're looking at things. We still have some issues going on that were present for the last decade, growing the last 2 decades, but are now becoming more pronounced than ever. One of the big challenges we see, again, there's challenges everywhere, but if we want to keep kids active, keep them physically fit and involved in sports, we do have some challenges coming on. We have to acknowledge these that are growing and they don't seem to be going away. One of the big things are costs. So the Aspen Institute has done some great work looking at the costs of and the socioeconomic status of parents with kids playing sports and not. Household income is the biggest predictor of early sport participation in youth. So if we want to get kids active and know who's going to be most likely to be active, income plays a huge role in that. And I think that's important because if it's costing, a couple $1,000s for my kid to play softball in the summer, to be part of their high school team, some parents just can't afford that. Or if you want to do 2 or 3 sports and get your kids involved in multi-sports instead of just one, it's a lot of money. And when we see that, that can have some effects. I look at down below the lower part of the chart. I got things listed: youth sports, golf, ice hockey, track, and football. This is the, then we have the second column is the average annual cost for one child. So these are numbers when they ask parents how much is it playing this different sports, et cetera. Now, I think it's important to know when I like to break down sports, I like to say there's, even though they might be sponsored by a high school or interscholastic activities, we have individual sports, we have team sports. And individual sports are those like the golfers, the tennis, the swimmers, wrestlers, track and field. Those they play as part of a team, but really they're competing as an individual. You can have a great swimmer that's on a poor team that can do very well and achieve great things. Team sports, on the other hand, are the ice hockeys, the soccers, the volleyball, where you compete as a team. And so, even though they're all sports, I like to break them down by individual and team. And if we look at youth sports such as golf and ice hockey, the cost, it's pretty expensive. And people say, I've talked to ice hockey parents and say, I wish I only spent 2,700 on my kid to play ice hockey in grade 5. It's about a $5,000 cost for me to get my son or daughter on the ice throughout the year to play hockey. It's interesting if we look at then how many participants are competing in high school. So down the road, what's it cost? We have about 231 golfers. Okay, we have 238,000 ice hockey players. Interesting. Look at down below the cost of track. Track's an individual sport. The cost of kids running in track and doing track and running type activities at youth is very minimal, a couple $100. We have 1.1 million track athletes in high school. Look at football. Football is, well, how can football be cheap with all the equipment? Well, most communities that sponsor football, the equipment is provided by the community club. So the parents are paying far less to go do that. There's 1.1 million participants in high school football. It's the largest population of team sport athletes. Track is this. And now I know there's other factors involved here, but don't tell me cost doesn't play a role. If it's costing me money to play a lot as a kid, I'm going to drop out. I'm eliminating some factors. I can't get on the field. I can't do that. And we have coaches overtly or covertly saying, you've got to play as a youth athlete to be on my high school team. That's going to drive this. If I'm telling a fourth or fifth grade parent, if your daughter doesn't play basketball all summer and all winter and exclude other sports, they're never going to be on their varsity team. Some of those parents are never going to do that. And what happens is we see sports such as uh, soccer, volleyball, basketball, kids don't transition to that late in their adolescence. They don't. They'll transition to sports like track, football adds some people, but by and large, kids don't start playing soccer or ice hockey in grade 10. They started at a very young age to do that. And if they didn't have those opportunities, whether cost or availability, they're not going to do it. We've also done, and this leads into specialization, which is what we've done a lot of in Wisconsin. Dave Bell has done some great work here. Our group, we've got a team of about 14 of us looking at specialization over a number of years. And what we learned at Wisconsin, the specialization levels, we know there's some problems. Some of the scales we use to measure specialization, the psychometrics haven't been developed as much as we like, but what we looked at, we see this about a third of the kids are specialized. The girls in all of our samples, the girls are more likely to be specialized at a young age than a boy in the same sport. And we see these numbers from, 24% in softball, baseball, up to like 54% in volleyball. We see this influence. And we also know there's a continuing pattern where specialized kids, even when we control for volume, are 2 to 5 times more likely to report an injury, overuse, or acute. And these costs, both direct and indirect, are about 5 million. And again, it gets back to what we're doing with specialization and cost. It's an interaction there that we have to acknowledge and know they're related. So here's an example of what we've seen historically. Football, about 1 million participants since 2003, 2013, 14, a little bit up, 223. The top sports, we see boys, we see soccer and basketball, those trend lines. Soccer's going up a little bit. That's the green line. Basketball is declining a little bit, but really nothing much there. The girls, we see this great incline. We see, volleyball participating going up, soccer participating going up. But look what's happening in girls basketball. Girls basketball is incredibly so. And instead of having like 450 to 500,000 participants in 2003, we've lost about 100,000 of those girls. They're not playing high school basketball anymore. We see this about a decline of 20%. And you could say, well, they're playing volleyball or soccer. That's not always the case. we see this. And again, it gets how do we lose these people? What's going on? I had an interesting conversation with a coach. He said he coached in this community with 22 years. And when he first started coaching there, he had 74 girls, 9 through 12 out for basketball. Now he's down to 21. And he lamented the fact other sports are doing this. But he said, really, but the girls that aren't playing aren't dedicated enough. They probably wouldn't be on my team anyways, which is, again, sending the message. What's dedication? Are they shooing other sports? Are they saying in sixth and seventh grade, you can only play basketball? If you have that mindset, the coach was blaming other sports, but it's like, that's the problem. You have to look inward there. If you have these expectations on these kids, boys or girls, that you've got to play a lot at an early age, you're excluding a whole population. Another example, we had a school with one of the largest schools in the state of Wisconsin. It's about 18 or excuse me, 1,900 kids. Year in and out, I talked to one of their coaches, and she said, "Tim, we have 17 girls out." I said, 70? 70 girls, grade 9 through 12? We said, no, no, no. We have a total of 17 girls, 9 through 12, in a school of almost 2,000 kids out for basketball. That is crazy. That's crazy. We talk about losing sports. There's something going on there that we have to recognize, and we have to work on that to go ahead and do that. As I mentioned, at Wisconsin, Dave Bell and our group has been doing a lot. We've identified, we know that there's some issues with specialization. Questionnaires have been done. We've tried to develop our own. We're on our fifth year of validating an item questionnaire looking at um, different factors that could play a role in specialization. We think this is going to help us better determine this. How much is cost? How much is volume? How much is psychosocial aspects of this? But this is coming down the road. I think we've published our third paper on that, and I think this will help elucidate a little bit more on that in terms of is it you can dial down on these aspects that are causing kids to maybe drop out of sport. With every challenge, we look at opportunities. There's other opportunities in terms of what we can do, what we can build on. If we know we're losing some kids, can we build on others? So one of the things we're talking about, we're always looking for opportunities to get kids, boys and girls, on the field. And one of the big ones coming out is flag football. So several years ago, the NFL started partnering with communities and sponsoring flag football at community and interscholastic levels in different states. And this sport is really taking off. I think if you have some entity like the NFL behind it, you get a lot of a buy-in. But they estimate, just 2 years ago, or sorry, last year there were approximately 21,000 girls playing flag football in the United States. This year it's 42,000, almost 43. It's a 105% increase. This is a tremendous opportunity, and it's something we do, and it checks a lot of boxes. It takes minimal equipment, it's unlike lacrosse or ice hockey. Um, Flag football does not require a lot of equipment. The fields are there, small that they can play indoor, outdoor. You can do this, and it's a great way to go. And we limit to some extent contact. We don't limit a lot. We don't limit all. One of the recent studies said 75% of the injuries are related to contact, so there's still contact involved, but we don't have people crashing into each other with a football helmet on. And some of the angst that parents have with collision sports, we're eliminating some of that here. If we look at some other data, I think it's very important. As I said, the NFL is in the third year of encouraging this. Other states are taking beyond it. I think the states that are biggest into this, Florida, they said they have 400 schools playing it. California, Arizona. The NFHS is putting together a rules package to be this. The NFHS expects that participation in girls flag football to surpass sports such as ice hockey, some of the other sports, maybe even baseball, softball in the next couple of years. I think it's really interesting. Point number four, 50% of the girls playing flag football are not playing in another sport. So this is important. So we've had either girls that have not played a sport, or maybe they played soccer, volleyball, they've sent away. They're coming back and playing flag football. So here's something that I think is interesting, that if we have 50% of the kids not playing a sport, this is a great opportunity. We need to explore this to get more kids, particularly girls, to get out and get active and go ahead and do this. And I said, we're going to go ahead and study this more. So, wrapping up, I just think, some things I really want to highlight. We just go over again. Um, I think this idea that sports are extra, physical activity and these things are extra, and they just kind of, oh, it's nice, but it's not important. It is. It's not a co-curricular activity, I think it's an extra academic activity in certain respects because we got to look at this. And when we talk about whether it's kids getting an influence on social media and having higher levels of depression, anxiety, et cetera, we have solutions. We have solutions available in every community across the United States to a certain extent. And I think if we get that idea that they're not just a game for kids, that the more we can keep kids active, it's a public health issue. And if we treat it as such, I think we could have a great um, maybe a better understanding and a new utilization of this. It's not just something extra, it's something ways to get kids healthy and active throughout their life. So I'm going to stop there. I do have other slides with citations that if you want them, we can go ahead and get them to you. Either Hannah or myself can go ahead and get these to you. But we do have citations on the benefits of sports in our papers as well. So I'm going to shut it off there and take questions, I guess.
Awesome. Thank you very much, Dr. McGuine. Really appreciate that information and sharing. We have opened it up for questions or discussion points if you'd like to share. If you want to go ahead and put information in the chat, feel free to do that now. But I will kick us off. I just am curious if your group has explored any impact of coaches and as athletics becomes more competitive and or perhaps more selective, do we see coaches, and how they might influence some of these health outcomes, especially mental health in student athletes? If you've explored that or looked at that at all.
Right. I again, there's been a greater emphasis. I know our state association had a mental health expert on our interscholastic association group for 15 years, and there's always an aspect of it. And the National Federation of High School has now made a recommendation to all state associations. You need to have mental health experts with your medical groups. It's not just preventing knee injuries or concussions. How's mental health aspect playing a role? And it's changed from mental health used to be or psychological intervention with sport, how to keep kids, performing better, getting rid of their performance anxiety to, hey, what's going on? Can we recognize mental health issues at an early age? Sometimes the coach may have a greater insight to what's going on. And if some kid's in trouble, do they have a team in place to deal with that? What's their mechanism to deal with somebody's exhibiting these signs and symptoms of there's something going on? It's not just me. It's not just the parents. We need to talk to the rest of the team at our school to go get this done. So we've done that. In terms of other things, though, in terms of participation numbers, as I said, the coach had told me the girls that weren't playing weren't dedicated enough to do it. That's why he had fewer kids. We talked to kids, to coaches, and looked at, who's most likely to recommend specialization or volume numbers that are high. And coaches now know that specialists, if you say the term sports specialization, that's a bad term. They know they want to say, no, 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 I don't want my kids to be specialized. I do not want that. They know not to say that. But in addition to that question, we asked them other questions like, what do you expect your kids to do during the season, off season, et cetera? And we had a large number of coaches. I don't want my kids to be specialized. But again, if they're a basketball player and there's a big AAU or a club tournament in the spring, I'd want them to participate in that tournament rather than going to their track meet and their track practices. So even though the coaches are saying, no, 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 we don't want kids to be specialized, you really do when these other actions, again, overtly or covertly, you're giving the message to you need to do things in the off season because my sport's more important than a kid maybe swimming in the fall, playing basketball in the winter, and track in the spring, which would really get a lot of, I think that's better for kids.
Thank you. Other questions? Oh, Bobby Joe Allen.
Hi, thank you for coming. I appreciate your presentation this morning. And of course, I just wanted to ask if your group has looked at the higher rates of depression among the high school girls being linked to, sorry, I had to write my question down. I apologize.
Okay.
I'm just wondering if your group looked at the higher rates of depression in girls because the decreased support for female athletes, particularly in the context of policies allowing biological males to compete in girls' sports. And if so, how might this impact their mental health and their participation across the board in
That's a great question. And that has been more to the forefront in the last, say, 18, 24 months. So we had not looked at that per se. That's one of the things that our group has talked about going into, looking at that. Um, Again, we're hearing anecdotes, but we're not seeing this large, widespread impact per se. Different states have different um, rules in terms of what they're allowing. Some states are saying kids can compete based on what they decide that day. Other people are saying, no, 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 you have to have doctor's notes and show evidence of X, Y, and Z. Um, I think it's going to be looked at. We have not per se looked at that particular issue, but that will be looked at in terms of what's going on. I'm sure. If not our group, some other group is going to do it too.
Yeah, I can just say I was a mom athlete to two kids. My son went on actually played in Wisconsin for a summer with baseball, then went on to college baseball. And it is something that's important to me as a female, as a former female athlete myself. I feel like it's got to be addressed. And seeing those numbers that you presented for 2020 and the skyrocketing depression within the girls, you know, there's a movement happening. And it's frustrating that, like, the NCAA doesn't want to address the elephant in the room. And I just appreciate you answering very candid about not looking at it, even though it's at the forefront. Thank you.
Yeah, and I think, as I said, there's people more important than me or with greater academics and experience than me I'm sure will take a look at this better. And I'm happy to help, but it wasn't the focus that we did, 3, 4 years ago.
Hi, Dr. McGuire. I guess just some commentary as a parent, things I have seen in my community is um, uh, with just kids' sports as girls is, and when you sign up for different things, especially when they're younger, many of the sports start prior to when people can get off work to actually transport your child there. Let's say they're playing soccer and they're in elementary. I always found that as a large barrier because most people have two working parent households. And if you don't have potential other family members or someone else to carpool with, that is a barrier. And this might sound silly, but back in the 70s and 80s, you brought your own snacks, you got your own stuff. You would have been somewhere in your community for all your games. Now there's this large expectation of somebody's parent is bringing snacks for everybody, and they better be fancy. And oh, our team's going to be playing in Florida this weekend. So
Yeah,
on top of that, parents do travel. Like, I think that is and if you don't start, you brought this up even with volleyball. If you're not there when they pick the first team, it's always those people who were there at the beginning who are on that top echelon team and trying to even get in a year or two later. Um, the writing's already on the wall. Um, and we've switched around some different sporting type things. And um, my child now does color guard. They do show bands here, so it's a lot of running around. And people don't consider that sporting, but anywho's, those are some things that I personally see. And once you get to this high school level, there's so much competition between teams and sports for gym time to practice. So, for instance, in our community here, how they have these zones for who goes to what school, it could be a 35-minute drive for someone's parent to drive them back to the high school to practice at 7 p.m. And that's just, some people are still working. And I think even people participation in supporting a boys basketball or girls volleyball game suffers to get people into being excited by those things and building community. The way things are set up, it's just not stuff people are able to manage in
right.
current
And
life.
And I think you mentioned, two parents working, et cetera. What about the single parent households?
Exactly. Yeah.
I just don't see this. And I know, ice hockey's big here in Wisconsin, bigger, and like Minnesota, some of the and stuff in the Northeast. But I make a joke here, kids don't ride public transportation at their hockey practice. They don't. I mean, if I want to see a car I want to drive someday, I'm going to go to the rink at 7 a.m. and look at the Lexuses and the Tahoes and the the big vehicles that these people got. And in some ways, I could say it's other sports too. Kids don't ride public transportation to their club soccer or basketball practices by and large. Their parents are driving them. Well, if the parents aren't available to drive them and have that economic resources to do that, we're eliminating them. They're not in that opportunity, and they're not going to transition to this later on. It's a big issue. That's why I said the money and the specialization go together and form this bad mix to some extent. Phil has a question.
Um, I have a question. I'm Mary Lloyd Ireland, good friend of Tammy Scarpella.
Yeah, I saw you at
Um,
Boston, I think, didn't I?
yeah. So, we need more mental health providers or whatever you want to say. But what do we do with these individuals? And oftentimes it's the athletic trainer who understands what's going through these young athletes' minds, and what counsel do you have of how do we have intervention? Because the parents oftentimes are, say no, nothing's wrong, and so I think somehow we need more health care, mental health professionals, and we found that during COVID that we didn't have enough of those.
Right.
So that's a public health crisis too. And my other question is, if you compare the athletes with the non-athletes in our program, we want to get girls early on, not necessarily that become athletes, but just teach them how to be active. It would be
Right.
interesting to see what you've done with the athletes and compare that. Do you think regular kids are less depressed, more depressed, or what is that answer?
Yeah, then like I said, traditionally, I think the ET Still group has done a lot of this, looking at athletes and non-athletes and showing that the young kids that had identified as athletes had better, quality of life and less levels of depression. I don't know. I guess the non-athletes, it's important, but that's where it goes back to the thing. Like I said 20 years ago, if that magic unicorn would come down, give me 20,000 fourth and fifth graders that are different economic situations and where they're living geographically, et cetera. And let's follow is how are those kids doing, whether they have FIED 3 days a week versus a no FIED versus athletics and FIED, those type of things you could really nail down with that. As I said, the cardiac Framingham study for youth kids, just basically go ahead and do this. As I said that 20 years ago when my hair was much darker. I didn't have as many wrinkles. I'm still waiting for that magic unicorn to come down and shower me with that money. I don't know. I don't know when it's going to happen, though.
Well, I applaud your work and keep going, and maybe
All right.
get
Well,
it to other states too.
thank you.
Philip?
Yeah. Hey, Tim, great to see you as always.
Hey,
Um, Going back to your points and thoughts on coaching perceptions and specialization. Apologies if I missed this, but in my experience, I have a lot of conversations with close friends that are collegiate coaches, particularly in the sports of volleyball and basketball, and they always have commented over the years how much they value their athletes that they've recruited and see success that have been multi-sport,
right.
non-specialized sport athletes. And then I've seen the opposite with my own children. One that's now a freshman in college as an athlete, and one that's a daughter that's a high school athlete. And I've seen the exact opposite from the coach's influence, exactly what you've shared with us this morning. So I feel like there's this huge disconnect between what the high
There
school
is.
coaches seem to think and what they think equates with success, which is specialization. They don't want to share their athletes across multiple sports, but the collegiate athletes, where the high school athlete may wish to become part of that collegiate sports team, has a very different view.
Right.
Have you guys examined that disconnect?
Not between. I think as I want to say, to me, most of the college coaches, that's their career. They're seeing this. The youth coaches, by and large, this is a side. This is something they think they need to do. I think they have less perspective. We're trying to educate that and look at that to tell the youth coaches and the parents, which are essentially the youth coaches, right? These are what's going to be good long term and do this. It's an educational uphill battle. We started this 6 years ago. I think we're making some progress, but as I said, now the coaches know what to say. No, no, no. But even though they are yes, 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 and it is, and we have to look at the parents aspect too. I'll give you two quick anecdotes. This isn't specialization per se, but what youth coaches think versus even higher levels. So we started asking football coaches, how important is it to play tackle, full contact tackle football to be a successful high school athlete in our varsity team? Because these kids aren't going to play college, right? 99% aren't going to play college. So the youth football coaches were saying, yes, if you don't, you need to play tackle football in grade fourth, fifth, sixth grade to be a successful high school football player. And it was like 70 to 80% of the youth coaches said that. Middle school coaches, it got down to about 50%. 50% of the middle school coaches said, yeah, it's important that kids play tackle football early to be a successful high school football player later on. Less than a third of the coaches we asked in high school varsity sports in Wisconsin said playing tackle football early is important to be on my varsity football team. So there, it's not college in youth or high school, but there's a difference between youth, middle, and high school coaches. Their perceptions of what's important at youth versus how it translates to success later on. The other thing I think is the parent aspect of this. Again, the coaches can do some things, but the parents have to be part of that. An anecdote we have volleyball. I was talking to a volleyball coach, a club coach in Wisconsin that did do this thing. They work with these kids, and all these clubs offer one-on-one sessions. So in addition to being in the club for extra money, you can come and work one-on-one with a coach. And they do this, and some people buy into this. And this coach told me how they had this case where this young lady was performing, and she was doing very well, but he said, even with all the extra coaching, etc., he said, I just don't know if you're going to get there. I know parents and she want to get to college on a scholarship to be a volleyball player. He said, and based on his experience, it wasn't going to work. This girl was going to be a very successful high school player, be a starter on their team, maybe be all conference, but the idea of taking that next level was going to be hard. He had a meeting with the parents and said, here's what's going on. Here's what I'm concerned with. Um, I think at this time it's a waste of your daughter's time and your money to go and do this extra training because I don't think she's going to get there. She's going to be a great high school player, and that's awesome. And what was the parents' response? We're going to get a different volleyball coach. That's how they dealt with it. Instead of taking the input and saying you're going to have a daughter is going to be very successful on her high school team and do great things, it's not good enough. So the parents who weren't the coach said we're going to get a different coach and they're going to take their money and do it. And I said that's interesting. And I saw the same thing. Youth coaches in Arizona, they talked about how they've worked with kids 7, 8, 9 years. And the comment to this coach was, "Boy, you're developing a lot of good players." He said, "No, we're just developing the rich kids. They're not going to play college. They just have wealth. That's why they're doing the extra coaching." Other questions?
B.
Yeah, thanks. That was an awesome talk. I'm really encouraged by the flag football example for girls, and I'm wondering if you could just speak to what lessons you think that we can maybe take away from that and maybe actionable strategies at the community level.
Well, I think anything, and again, that's one example. Well, the other sport, you think about the other sport that I think that's going to come down an interscholastic level is pickleball. Pickleball is a community sport, and it's one thing to have sports, but what do they check the boxes? Pickleball is a sport that can get one, it's low cost, the equipment's already there, right? Tennis courts can be converted easily, can be indoor, outdoor, and it's a lifelong sport, right? You can play boys, girls, you can play co-ed together. Those type of things beyond flag football. That's an example. So it's not just having a sport, but what translates to, is it cost effective? Can we get large people involved? And can we build on that? We can debate like how athletic you have to be pickleball player if it's a big thing in the retirement communities. I get it. I'm not playing yet, but I've had enough friends who play or their wives play, and they talk about their injuries. So that could be something. But Yeah, I think and anything we can do to increase opportunities are good. We have a fair number of girls playing now. They're wrestling. The biggest growth in high school wrestling is due to girls wrestling now. And I think it's good because for years in Wisconsin, they could compete, but they had to wrestle the boys. Now we have they can be they have one high school team, but they have a separate tournament series for girls that want to do a separate tournament series and just compete against girls through sectionals and regionals and getting to state, which I think is a great option for those kids. But there's always things, and again, bidding on the national levels, it's amazing what you see. We'll have things we need to do X, Y, and Z, and we'll do this rule or do this thing, and it's like, well, and I'm always like, I'm the stick in the mud, like, what's the cost? What's the cost benefit analysis? We're adding this equipment or making these rules. If it does it and increases the cost, double or triples the cost to participate, we're going to lose kids. So how do we get that happy medium? That's all I have on that.
Thank you.
Awesome. Any other questions or comments? Discussion points? Perfect. Well, Dr. McGuine, I do appreciate your time today. Thank you for presenting for our coffee talk this month. We will be returning our series in I guess, real winter coming, January, February. So look for that information. But on behalf of the Active Girls, Healthy Women, Dr. McGuine, thank you so much for coming today and presenting for us. And we will definitely need to have you to Lexington.
All right.
Before the next IAS is held here, which who knows when that'll be. So
Yeah.
hopefully we'll see you soon. But thank you, Tim, very much for your time. Thank you, everyone, for your attendance. And we do appreciate you. Have a wonderful
Thank you.
day.
Thank you for having me. I appreciate this.
Yes, thank you.